Yes, we're all set.
Thank you. This is Board President Doyle calling back the Oregon Board of Pharmacy meeting from break at 3:15 on Friday afternoon, June 14th. We now move into the section of issues and activities. We have stated before us the 2024 board meeting dates in August, October, November, and December, and the board meeting dates for 2025 as well. And lastly, the 2024 rulemaking hearing dates set for July and November 2024. There's the upcoming NABP district meeting in Albuquerque in October of 2024. Executive Director Fox, any information or comment on that upcoming meeting?
Not at this time.
Okay, thank you. We also have our consent agenda. We have consent number 1 and consent number 2. Those being the license and registration ratification report and the board meeting summary from April 2024, respectively. Is there any board discussion on the consent agendas? I, Board President Doyle, do not have any. Board Vice President Chin?
No comments.
Member Beeman?
Discussion.
For the Barmore?
None.
Board Member Hall?
Oh, nothing.
Member Hemmons?
Same.
Member Joyce?
Like that.
Member Patel?
Nothing to add.
Is there a motion to approve the consent agenda as proposed?
So move for Board Member Joyce.
For second?
Second, Board Member Chin.
Motion has been moved and seconded. We'll call roll vote to approve the consent agenda as proposed. Board President Doyle, yes. Board Vice President Chin?
Yes.
Board Member Beeman?
Yes.
Board Member DeBarmore?
Yes.
Board Member Hall?
Yes.
Board Member Hemmons?
Yes.
Member Joyce?
Yes.
Board Member Patel?
Yes.
It passes. We'll now take public comment. Please note that the board will not deliberate items such as formal request issues currently under investigation, requests pending before the board, or currently proposed rules during public comment. Public comment is also only limited to matters that were noticed on the board meeting agenda for this meeting. Comments will not be allowed that are longer than time allotted by the chair. Each person has 3 minutes to speak. We will begin with our first and only speaker, that being Mr. Mayo from OSPA.
Hi all, can you hear me okay?
Yes. Go ahead.
Great. First of all, thank you for the time today. It was good seeing everyone yesterday. Just a couple of quick comments. There are many issues obviously affecting pharmacy right now. The actions you take as a board have major consequences, obviously, and we are asking that you take into account those actions when you make decisions and as you prioritize your work over the next year. We ask that you prioritize efforts to increase pharmacy access, especially in rural areas. Oregon is the second worst in the nation for pharmacy access. Decreasing the overburdensome rules on RDSP, pharmacy lockers, and telework is essential for increasing access. Revisiting these rules should be prioritized, which is why we ask you to amend the RDSP rules. We appreciate you guys taking our petition and reviewing it. And we thank you, even though it was denied, but we do thank you for at least discussing the ideas and moving those to the SBAR. We hope we can now sit down, we hope that we can now move forward and get some of these rules prioritized. In addition, I want to let you guys know that we're obviously a pharmacy association that is focused on pharmacists and the well-being of pharmacies. However, we've become more of a patient access group that's looking, a patient advocacy group that's working on patient access. We recently received a grant through our new foundation, the Pharmacy Foundation of Oregon, from the Eastern Oregon CCO, and we're going to be putting a pharmacy locker over in Eastern Oregon in conjunction with Murray Drugs. There are currently 21 critical access pharmacies in Oregon. We've been working with Trevor Douglas with the Oregon Health Authority to increase that amount to 56 moving forward. And what our goal is through the foundation is to get more of these pharmacy lockers put in at places that the critical access pharmacies can use to increase their patient access for their communities. So if you can please prioritize that as one of your rulemakings to make it more accessible for patients and pharmacies to implement, we would appreciate it. And with that, again, thank you for your time. Thank you for the conversations yesterday and today, and have a wonderful weekend.
Thank you, Mr. Mayo. That concludes public comment to the Board of Pharmacy. We will now take time for each member to provide comments, ideas, items for future board meetings in the section that we call matters to be discussed by the board. So we will begin round robin. Please feel free when I call your name to share your ideas with us. Board President Doyle, I have no matters to be discussed. I appreciate having served the board for the last 4 years, and I wish everybody well-being and good luck as we continue on the board in the future. Thank you. Vice President Chin.
Board Vice President Chin, and just wanted to make a few comments about the NAPB annual meeting. The annual meeting is very different from the regional meeting, which is very much focused on moving things forward and having lots more education and topics to discuss, where the annual meeting is like our business meeting today. It's a business meeting. So wasn't a lot of new information that I needed to bring back. I would say that the keynote speaker was Corey Feist, who did a really well done presentation on the Dr. Lorna Breen Heroes Foundation. She was the physician in New York during COVID who did not understand how much pressure she was under, and kept coming back to work even after being sick, and eventually ended up taking her own life. And they have started a foundation in her honor to really work with healthcare workers on self-care. So that was obviously touching. I can't talk about it yet. But if you have an opportunity to look up the Dr. Lorna Breen, BREEN Heroes Foundation, that was a very worthy cause. Several of us were offered an opportunity to visit Walgreens Central Fill location. It was amazing. I have never seen anything so automated and so precise, and so everybody was posted and proud and happy to be doing that work. It was an amazing place. What was interesting is that the robot thingies make 0 errors. The errors that come out of the place are all human errors. So that was a big, that really helped me to see what that meant, what a central fill meant. That's why I would love to see an RDSP. There were 3 resolutions, nothing earth-shattering, nothing controversial. Drug shortages, we need to work with all the other players to try and rectify drug shortages. That was the big one that I remember. I'm trying to get to, I don't think, unless anybody really wants to know the other 2 resolutions. This resolution. Drug shortages was the first one. Task force on to assess expanding access to the NABB competency assessment examination. So there's a task force that's going to go for maybe allowing people to take their Naplex before they graduate so that there's not such a delay. And then there was a development of a national forum for pharmacy professionals recovery programs. Just like we are struggling with people who are having substance abuse issues, trying to have more of a bigger conversation about how do we help people stay healthy and continue to be able to work safely and treat substance abuse.
Board Member Beeman.
Board Member Beeman, I just want to say thank you to our two outgoing members personally, because they have put in so much work and effort and time and energy and probably literally blood, sweat, and tears over the years that I just want to say thank you from as a citizen of Oregon and as a fellow board member for your insights and perspectives, and just know that you have made an impact.
Member Hall.
Remember all, I don't have anything today.
Member Hemmings.
Nothing to add, thank you.
Member Joyce.
Board Member Joyce, yeah, thank you, Richard DeBarmore, for your years of service, your attention to detail. Nothing gets past you in our rules. You'll catch something that's off, a word that's off, and you'll bring it up and correct it. And your attention to detail, it's just been beyond human. And Ian, yeah, I worked with you back in the late 2000s, and it was a pleasure working with you then, and of course, a pleasure working with you on the board. So thank you for your service.
Member Patel.
Thank you, Ed, but thank you for your service, and looking forward to working with 3 new board members for next 12 meetings. Thank you.
We will now move to matters to be discussed by agency staff with Executive Director Fox.
I don't get a chance. Oh, you
No, I called on you.
did? Didn't.
I apologize. I
Or
was.
was Marie? Did you call me? No, you skipped right on over me. You
Remember-
already forgotten about it.
I'm sorry, I accidentally checked you off. I got ahead of myself with so Board Member DeBarmore, I apologize.
But you guys were all so sweet. Thank you. I have enjoyed the last 8 years, as hard as they've been. There's just one business thing that I want to say, and I was going to even get emotional today because, gosh, it's some of the time has sucked being here. COVID sucked. And some of the things we've had to deal with have been really, really hard. But we have made a big difference in a lot of things. So I've enjoyed it. I've learned so much. But I do want just one business thing. As you guys are looking at inspections, as you guys are going out and evaluating pharmacies, think to the things that are going on and all the pressures, the things that you look at, please take into consideration how relevant they are and what impact do they have on patient safety when you're taking the time to look at them in that moment. One specific item that I saw in the inspection that really came to mind is the questions around interpreter services. There's nothing in statute that requires the information to be readily retrievable upon inspection. There's nothing in any other healthcare provider's regulation that requires the information to be readily retrievable upon inspection. The information is not possible to have readily retrievable upon inspection. It is available. It is retrievable. It can be provided. Could it be needed? but it is not available upon inspection in the moment. So and when the questions come out and things are bolded and highlighted, and pharmacists who are very diligent and very particular about making sure they're following all the rules, and they know they can't have that information, and they know they can't provide it for you because those interpreters do not provide that information and refuse to provide that information. It sets pharmacists up for failure. So my last moments of my wisdom, before they come to you as public letters rather than board member comments. But again, thank you guys for everything. I've learned so much from all of you.
Sincere apologies for accidentally.
Right.
Are there any additional board comments, particularly in relation to what board member Barmore had shared? Just seeing if anybody wants more conversation around that.
I would, something that light bulbs, when I hear things, I'm sure I was just gonna start writing it down if so I don't lose it for 2 months. An attestation is something that you have to do for some parts of your licensing, and I have to do attestations for many things. And having an attestation for things that you can't have readily available, but you attest to, and then if you've attested to it, and a complaint comes before the board, you could say, well, you attested to it, and then have something, rather than spending all of the time on doing something that you can't do. An idea.
Any other board comments? So we'll now move to matters to be discussed by agency staff with Executive Director Fox.
Okay, before I get started, I'm gonna pass over to Director Effermall.
Staff Member Efferoff, I just wanted, for the record, to be able to, kind of add a little bit of context to, I appreciate the feedback from Board Member DeBarmore, definitely appreciate all the feedback and how we could do better and how good intentions can be perceived differently when going through the process and really putting that intentionality related to inspecting to ensure safety and compliance with the rules and maybe understanding what the inspection process is for, related to assessing that compliance. And I just wanted to say the exact specific situation that you have provided by going out on inspection and identifying that, again, this is an OHA regulation, it's a state, it's a federal requirement that pharmacies have to follow these. We're really ensuring we have been getting communication from the public that access to interpreter services, the prescription readers and the LEP dual language labels are not necessarily maybe where everyone would expect them to be with how long the regulations have been in place. So really thinking about the patient population as we do those inspections. And it did come to fruition that the requirements that were put in place by OHA, the different interpreters were potentially not providing the information that they were required to pharmacies for pharmacies to be compliant. So that gave us the ability to reach out and work with OHA, which we are currently doing to rectify and remedy that issue. So being able to do that, I know a perception could be that that's a disciplinary route, but asking for a response, everything comes back to the board. So understanding too that inspections, it's not staff making any decisions, it's not staff taking any action, it's staff following the staff delegated authority to collect information, which then is provided for the board to determine how you would like to use that information. But for us to have the sensitivity of, is that information needed to gather as we assess it, and how do we carry the weight of all of that? I hear the comment. I just wanted to also highlight though that sometimes those things can help with communication and ensure that patients are receiving the care they need and that other entities are monitoring and regulating how they should be too. Thanks.
Thank you there. Just adding on, I think staff knows me well by now. I have 23 items for the board and I'm gonna try to get through before 5 o'clock. thing number one, I just wanted to just follow up. I believe I said it yesterday. I feel like we've been meeting for 2 weeks this week. But the staff delegated authority, I know it came up, and the rack and work groups, just as a reminder, AAG Hunt and I will be bringing that forth either in August or October time periods. Around that same time period too, the board is going to hear a training from the Ethics Commission on their new authority and what's expected of all board members. They're doing a cross-state training with various boards and agencies. And so ours would be, I believe ours is in August. Yes, August. The other piece, I just want to just follow up early. We had the discussion about the budget. Want to thank you. Hopefully it was helpful. One of the clarifications I just want to just share is when we talked about the fee pieces and what we need to do moving forward, one of the things that we have already done our due diligence and looking at the Western states and the fees that each of the Western states. And thank you, President Doyle, for showcasing your fee that you had to pay in California. That's one of the ones that we noted the discrepancies on where we are and where they are, whether it's every 2 years, every 1 year. And so the CFO's office and the governor's office has that data. President-elect Chin has already talked about NABP. One of the things that I'll just share, just want to appreciate Walgreens for allowing us to check out the central field and see all the robots and everything that was happening in that facility. It almost made me feel like I wanted to go in pharmacy tech again for Walgreens. But it was a conversation about DSCSA that happened during the conference. I thought it was very interesting, and I'm sure that more conversation is going to happen around that topic. I want to thank our office manager, Naomi Graham, for all her logistical support, lunches, supporting everything on the back end. So if you get a chance, please thank Naomi. She does so much for this agency. We just thank her, and I just thank all the staff. We've been going through a lot of challenges over the last year. From a staffing standpoint, from an operational standpoint, we've had some vacancies in the compliance department. Those vacancies have been filled. Those 3 individuals will be starting in a couple weeks. I want to thank Director Efremoff and all the compliance team. They've done a great job, even though it's been very tough and hard. They have done a yeoman's job of continuing to make sure that we're able to provide even the cases that you saw at this board meeting. Now, as I stated before, it may change because of the staffing challenges that we do have, but just want to recognize the hard work that the agency staff are doing on your behalf. And I want to give a kudos to the licensing staff who, when we look at, there's a lot of conversations in the state about applications from time we receive applications as a licensing board to actually issuing those applications within a 30-day period. I believe we're at 76%. Our goal as our KPM is 75% within 30 days. We're about 33, 35 days, but we're exceeding that by 1 percentage point. And just want to give a kudos to Director Hennigan and the licensing team who's doing a great job. Even with the staffing challenges we have even in that department. Great work there. I want to give congratulations to President-elect Chin, Vice President-elect Joyce. Look forward to working with the two of you as of July 1. Moving forward, I want to thank Board Member DeBarmore and President Doyle for your service to the board and to the agency staff. We really appreciate your insight and your leadership. I'm getting near close. I'm getting there. I'm going to say happy Father's Day to staff, to those listening in the profession, since Father's Day is this Sunday. I also want to just recognize Juneteenth is next Wednesday, and there's many events happening over the next week that recognize and bring great awareness of the holiday and the day of action that we hope everyone participates in those activities. I know it's mid-June, but this is also Pride Month, and would like to acknowledge the LGBTQIA plus population within the profession, within the agency. We have our second quarter all-staff meeting in a couple weeks on June 27th. We'll be having a lot of great conversations about how we move forward the goals and initiatives that you have already outlined at this meeting and previous meetings. And lastly, I would just request the board and the new board members coming on board just to be patient with agency staff if we continue to work through staffing challenges and realignments and try to get our budget in a better place as you've seen today over the next couple of budget cycles. With that, President Doyle, I turn it back over to you.
Board Member Doyle, thank you for your presentation. Do board members have any questions or follow-up about what Director Fox has provided? Hearing and seeing none, I asked staff member Melvin to provide a little bit more information about mobile device management implementation.
Yes, staff member Melvin, as an enterprise-wide initiative, the state will now manage all mobile devices for every agency. So that's one less thing that staff member Melvin has to worry about anymore. So that's the reason I'm collecting your devices. We're removing the old program and you're having the new program installed. And that simply means if you were to lose the device or you open something that had a virus, the state can easily target that and shut it down quickly. So I will reach out to each board member individually after the device has been reconfigured, and they will be shipped to your residence or your business where you can sign for them before the August board meeting mailings are due. So hopefully in the next 2 weeks. Any questions?
Board Member Hemmings, we have to sign for them when they're delivered.
You know,
The holidays come up.
no, and it won't be.
Okay.
Oh, well, and I'll talk to you offline about it. But yes, FedEx at this point, you have to put that on your slip if you want someone to sign for it. Since COVID, they kind of changed things a little bit. So I will talk to you offline. No, we can make arrangements.
Thank you, staff member Melvin. For board members who took written notes before or during the board meeting, please provide your written notes to staff member Melvin. Please add your name and today's date and quote unquote confidential written across the top if they were taken during executive session. If you would like to keep your written notes, please go ahead to the board office before you depart the building so that staff can make copies. If you took electronic notes outside of OneDrive, email your notes to rachel.melvin@bop.org and .gov. There are a motion to adjourn the meeting at 3:44 p.m.
So motion.
So moved. Board Member DeBarmore.
Motion by board member DeBarmore. There's a second by board member Chin.
Board Member Chin seconds.
Motion made by DeBarmore, second by Chin. Vote to approve adjournment at 3:44. Board President Doyle, yes. Board Vice President Chin.
Yes.
Board Member Beeman.
Yes.
Board Member DeBarmore.
Yes.
Board Member Hall.
Yes.
Board Member Hemmons.
Yes.
Board Member Joyce.
Yes.
Board Member Patel.
Yes.
A motion passes. We are adjourned. Thank you very much, everybody.